Hello everyone, welcome back to our channel. Another DOH program topic that we're going to discuss today, which is your integrated management of childhood illnesses. So IMCI protocol is a long topic, but the topic that I'll be discussing today is just the introduction of this concept. For the other concept under your IMCI, we are going to discuss that on a separate videos. But for now, we are just going to focus first on the introduction by answering the question, why is it created? Okay, who created the program? And what are the general concepts or basic concepts about these programs? To start with, let us define first what is integrated management of childhood illnesses, or your IMCI. So IMCI is basically a method of assessing and classifying the severity of the child's condition in order to provide a proper care. There are a lot of situations wherein under five children does not receive any proper treatment, wherein due to the common childhood illnesses, they may suffer from disability or even worse, death. Okay, that is why IMCI actually was created by World Health Organization and UNICEF in order to address the possible complications of common childhood illnesses. So basically, this program aims to reduce the morbidity, which is the illnesses, and mortality among under five children suffering from common childhood illnesses. So common childhood illnesses, we're going to discuss the list of these common childhood illnesses that can be addressed even without the aid of a physician. Okay? For as long as you go to the health center and a midwife or a nurse, we're going to handle the situation. This is an example of those programs that can be handled by nurse and midwife even without physician or without the physician. So this is what we call your protocol-based instructions that we need to follow in order to address a specific problem in the community. Now, what is IMCI? So IMCI is actually created when World Health Organization in the year 1990 found that in the low middle income country, there is a 10 times death, okay, more death among children below 5 years old compared to those who are living in urbanized community. And this is because due to the following reasons. Number one is because of the lack of resources or the lack of 5 M's. So what are the 5 M's? We have your money, machinery, materials, your method, and your manpower. And on top of that, there is also the reason also is the poor quality healthcare on those said countries. Because as we already know, good healthcare comes with price. So it means to say that if you have a low income country, you would not expect more from them in terms of healthcare as well. Now, because of that, okay, the IMCI was actually created to strategy to reduce the mortality, or a strategy to reduce mortality and morbidity associated now with major causes of childhood illnesses in the community. And this is a joint venture between the World Health Organization and the United Nations Children's Foundation, which is created in 1992 to address also this is also to address your Millennium Developmental Goal number 4, or reduce child mortality. Okay, MDG 4, or reduce child mortality. Now, what are the objectives of this program? So the objectives of this program is to do the following. Number one, reduce death among under 5 children. The program is also aimed to reduce the frequency of severity of illness and disability caused by common childhood illnesses if left untreated under 5 children. And of course, to contribute to the development or to the growth and development of under 5 children as well. So these are the objectives why the IMCI was actually created. Now, there are two age categories under your IMCI. This is important for us to know because different categories requires different approach and different management according to their age. So the general age group that we are going to cover under your IMCI, or the target population, is the children less than 5 years old. The children less than 5 years old was divided into two. We have the young infant, which is from 1 week to 2 months old. And from 2 months to 5 years old, this is what we call as your young child. Again, 2 months below is young infant. Okay, 2 months and above is your young child. But the coverage under your IMCI is your under 5 children. Meaning, if the child is already more than 5 years old, we can no longer use this protocol to manage their common childhood illnesses. For example, if a child comes into the clinic with the common cold is common to children. If the child is less than 5 years old, as a nurse or as a midwife, we can manage the condition for as long as we are trained in the protocol of IMCI. But if the child is already more than 5 years old with the same signs and symptoms or the same concern, okay, we cannot handle the situation, but we can refer it to the physician, and the physician is going to manage the condition, okay, or treat the condition accordingly. Now, what are the 8 IMCI guidelines, okay, or 8 principles that we need to follow in performing your IMCI? Take note that each of these steps or guidelines has specific steps on it, but we are not going to discuss that in this video because our focus on this video is just the introduction. So what are the 8 principles, okay, under the IMCI guidelines? Number one, ask the mother of the children's problem. So what is the children's problem? Okay, so you ask the following. Number one, okay, assess for general danger sign. For the general danger sign, we have your KUVA. Okay, we do have a separate slide for this, but to give you an idea, KUVA is your general danger sign, meaning to say if you find this upon assessing the patient or the child, you will need to do an immediate first aid treatment, and you have to refer the patient to the nearest healthcare facility. So these are a group of signs and symptoms. Okay, example for C, that's your convulsion. U for you're unable to breastfeed or drink. V, vomits everything. And A is abnormally sleepy or lethargy. We do have a separate slide for this. Don't worry. You can actually copy those phrases later on. Another one is assess for main symptoms. For the main symptoms, we have your cough, difficulty of breathing, diarrhea, fever, and ear infection. So after assessing the danger sign, you will need to assess the main symptoms, and the main symptoms would direct you to what possible condition or classification of disease does the patient or the child has. This will lead now to the other assessment categories, which is the nutritional status. Okay, we have to assess also the nutritional status, including the nutritional status, immunization, and vaccines of the patient. Another one is the limited number of clinical signs used. Okay, then the combination of signs leads to a classification rather than a diagnosis. Using the IMCI, we are going to classify the condition. We are not going to diagnose the child. Only physician can do that. So what we're going to do is we're just going to classify the condition based on the group or cluster of signs and symptoms that they have, depending on the category. Another one is not for trauma or other acute emergencies. We will not make use of IMCI if the child's condition is emergency situation. Okay, it is not applicable with this protocol, or even trauma. It is not applicable. So you need to send them immediately to the appropriate healthcare facility. The other one is the use of limited number of essential drugs and encourage active participation of caretakers. Here, we do encourage the use of common drugs. So these drugs are already based on the protocol set by the Department of Health. And in the management of the child's condition, we need to involve the family, okay, especially the caregiver of the child, because that is very important, especially if we send the child home for home remedy. And for the number 8, we have essential components. Essential component is counseling and caretakers, and this has to be based on evidence-based syndromic approach, or your EBSA, which means that we use eyes, ears, and hands for the assessment. We come up with rational and effective and affordable use of drugs and diagnostic tools, and also the realistic and cost-effective way to manage the condition as much as possible. Okay, take note that we are using these guidelines because the community has lack of resources. That is why it needs to be realistic in terms of the management that we're going to choose, and of course cost effective, or as much as possible at a lesser cost for the family. Now, we mentioned earlier what are the danger sign and what are um, the main symptoms. So the danger signs includes, as I mentioned, the mnemonics is CUVA. CUVA means C for convulsion, U for unable to drink and breastfeed, depending on the age of the child, vomits everything, and abnormally sleepy or lethargy. Okay, or the child has difficulty awakening. Okay, when asleep. So those are the general danger sign. If you find this general danger sign, we will classify the condition as severe. It means to say that we need to provide the initial first aid and then refer to the physician or to the nearest healthcare facility as early as possible. Then the main symptoms includes cough, difficulty of breathing, diarrhea, fever, and ear infection or ear problems. So these are the main symptoms that you need to look into after assessing the general danger signs. So how does the process flows? Okay, this is the general principles on how does the process flow. Number one, in a outpatient healthcare facility, like for example the health center, you're going to assess the patient. So assess first for the danger sign, if there's presence of danger sign, which is your COVA. Then after assessing that, whether there is danger sign or not, the next thing that you need to do is to assess for the main symptoms. After assessing the main symptoms, you need to assess for the nutritional status, immunization, the vitamin A supplementation, and the potential feeding problem, plus HIV status of the child, especially if they were born to an HIV positive mother. Then after that, you're going to check for other problems if there is or if there is present. Okay, and after that we are going to classify the condition. Is it on the pink one? So the three colors is pink, yellow, and green. For the pink, these are the urgent referral problems. Pre-referral treatment should be given, or the first aid. Advise parents and refer the child to the nearest healthcare facility. Oh, that is if the child's classification is pink or severe condition. If the child's classification is green, meaning home management. Okay, for home management, okay, we only need to provide counseling, okay, to the caretaker and how to manage the child's condition at home. Okay, and the second classification, which is the middle classification, okay, is your yellow, which is the treat patient on outpatient facility. So you treat local infection, oral drugs, and teach caretaker, and you would ask the mother when to return, okay, or explain to the mother when to return. So again, the highest classification is your pink, followed by your yellow, and the last one, which is the most mild condition, which is your green classification. And for a red classification, you have to refer them into emergency triage treatment, or for ETAT, for further diagnosis and treatment and monitoring and also follow-up. And when you send the children to the nearest healthcare facility, you have to come with the child, okay, during referral. So the actions for positive danger signs, if there are positive danger signs, these are the initial actions that you can do. Give diazepam if the child is convulsing. Quickly complete the assessment. Give any pre-referral treatment immediately or the first aid. Treat to prevent low blood sugar, okay, whatever it is, if it's plan A, B, or C, that would be discussed on a further discussion on a specific management. And keep the child warm, and also refer the child urgently after giving the child or after the child receives the first aid, depending now on the child's condition upon assessment and after classification of the condition. Okay? Then the common childhood illnesses that you can assess and manage under IMCI are the following. We have your pneumonia, diarrhea, dengue, which is your under dengue risk, your malaria and your malaria risk, no malaria risk, and your measles and your ear problems. So these are the conditions that can be managed under this program-based protocol. So there you have it. If you do have any questions, just feel free to comment on our comment section. Thank you once again for watching our videos. Don't forget to like, share this video, and of course, subscribe to our channel. Once again, thank you very much. Bye for now.